We are here to discuss today the results from the NARCOMS marijuana ancillary survey. NARCOMS, if you're not familiar with it, is the world's largest patient-driven registry. So twice a year, participants log in and tell us how they are living with their MS. In addition to that, we invite them to participate in what are called ancillary surveys or special surveys that are outside of the regular updates. And the NARCOMS marijuana ancillary survey was one of those opportunities. So we invited all active participants, about 12,000 of them last August, to participate in this one-time cross-sectional anonymous survey. And that's actually key. We'd had a number of people asking us for years why we didn't ask about marijuana usage. But the flip side of that is the people who were concerned about if we did ask about it, it's not legal in a lot of places, it's still not federally legal, and we do have confidential information, personal information in our NARCOMS database. And so people were concerned if they were to answer those questions, it would somehow be tied to their employment, their insurance, those types of things. So we decided to talk about the topic, but in a way that it was not tied to the NARCOMS database. So we actually ran it on an external website. It was completely anonymous. So we wanted to just really see if patients were willing to talk about marijuana, and they overwhelmingly were. We had 5,600 responses in a single month to discuss legality of marijuana, past marijuana usage, current marijuana usage, if they'd spoken to their doctor about it, and then of course some background history and their MS status. Since it was anonymous, we didn't have it linked to their NARCOMS information. Well, so first of all, we found that patients are willing to talk about it, which I think is really important for treating physicians and MS care practitioners. That there are some topics that patients and physicians feel uncomfortable discussing, but it turns out if you ask the question, particularly about marijuana, we had a lot of people willing to talk about it. So what we found was that 92% of people think it should be legal in some form, and it's about a 2/3, 1/3 split for with a prescription or just outright legal. We also found that 16% of our participants that responded are currently using marijuana in some form. And so we classified marijuana as what you would typically think of street marijuana, which is smoking. And then it also included any medical marijuana or substance derived from marijuana. So we didn't discriminate or delineate between the types of marijuana. It was just classified as marijuana. So we have 16% users, more males than females, and that's relatively typical from other research that's been found. And so I think they also told us that about 50% of them have considered using it for their MS. 82% of them would consider it if it was legal. And about half of them have talked to their physician about it. So that was one of the things we also asked them, and 48% of the participants that responded are living somewhere where it's legal in some form. So there's about 4 types of legality right now, so clearly it's not federally legal. But state-wise, there's 4 different levels, and so there's medical marijuana only, there's personal use only, there's medical and personal, and then there's the 4 states that have it outright legal. So we are about 50% legal in the United States, state-wise, and so I think that's made it easier for people to talk about. We're still not sure how willing people would be to talk about it if it was tied to their confidential information. I think in the future we will ask some questions in the regular update surveys and allow people to opt out if they don't want to ask. I think as the tide is turning, it becomes easier to talk about. It's one of those things that's really, really difficult to study. There's some evidence of particularly the medical marijuanas, that it can be effective in certain diseases, and MS may be one of them for certain things like spasticity. But it's really hard to study if physicians can't have access to it. We really wanted to bring the patients into this discussion. The studies that have been done so far, the clinical trials or the smaller studies, have really maxed out at about 700 people. And of course, as we know, there's a much larger patient population that have opinions. And so we were really wanting to give them a voice to this topic, and I think they came out strong in support of, at the very least, that it should be talked about, and that they would consider using it if it were legal.